from the Centers for Disease Control and Prevention in Atlanta regarding a higher than normal uptick of West Nile virus. And we're
That's
still
carried by mosquitoes.
Yeah,
right. Okay.
Exactly. We're still early in the season, so it's just kind of the beginning of mosquito season. August and September, it really peaks out. But right now, so far, 42 states out of 50 have reported West Nile virus infections in people, birds, or mosquitoes. And, we first saw West Nile in 1999 in the United States. It was first detected on the west side of the Nile in Egypt, and then made its way over
spread.
here. Mm-hmm.
And horses can get it too, right?
That I don't know.
I'm pretty sure I've heard that horses can also catch that.
Yeah, there have been 4 deaths so far, and this is the highest number of cases reported since 2004, which was sort of a peak year. And so, we're looking at sort of a not necessarily an onslaught, but let's hear what one doctor from the CDC has to say regarding this year's current totals.
A lot of people become infected with West Nile virus and never develop any symptoms. And a large number of people who do develop symptoms have mild symptoms such as a headache and fever. A very small percentage of people go on to develop severe symptoms such as encephalitis or meningitis. And those are the infections that most often may lead to death, and that's about 10% of the cases that develop encephalitis or meningitis might die.
And we should mention that 80% of the cases so far have been reported in 3 states, Texas being number 1, followed by Mississippi and Oklahoma. California, we don't have a big problem with mosquitoes here,
right,
but we do peak on the West Nile virus, and it could just be the sheer number of people that live here, sooner or later.
Skewing us that direction. And
Right.
Randall, I just checked. Yes, I was right. Horses can catch it. Same way we catch it. They
Mosquito
get
bite.
bitten by a mosquito. Same delivery.
And the doctor, Stephanie, I don't have her last name in front of me right now, told me that the reason why birds are big transmitters of it because when they get it in their system, they carry a lot of the virus in their blood, and then a mosquito bites and picks up.
Transfer it.
They transfer it. That's how mosquitoes give it, how it goes from one mosquito to another.
They're little virus vehicles.
Yeah, exactly. So, but there are ways to prevent it, and this is what the good doctor has to say.
If you have any symptoms that concern you, you should check with your healthcare provider. It is important to note, however, that there's no specific treatments for West Nile virus, and so we really need to focus on preventing illness in the first place. And so this can be done by wearing insect repellents or long sleeves and pants when going outside, and reducing the numbers of mosquito breeding areas, such as standing water around your house.
Dr. Stephanie Yendel with the Centers for Disease Control and Prevention. She's not in Atlanta like they are. She's actually based in Colorado. But she had some great information on the whole West Nile situation. So we wanted to update you on that because West Nile is one of those things when you're exploring,
You can be prone to mosquito bites.
Right.
If you're out there.
Exactly.